Good morning. Good morning, Facebook Live. Good morning, friends. Good morning and welcome to Morning Coffee. We always love this moment when we see your faces appearing on our screens, especially at the second day of December. Who can believe that our year is almost over? We are so grateful whenever you join us for our weekly morning coffee calls, which have not been so weekly lately, but we are happy to see you here with us this morning, just after Thanksgiving and the season of giving and gratitude. My name is Lisa Payton Kerr, CEO and president of the Foundation for Black Women's Wellness. And we are here today for a very special morning coffee conversation, along with Aaliyah Stevenson, our co-host, Chief Programs Officer from the Foundation, and our wonderful team on the background managing today's event. Morning coffee, as you know, is one of our contributions to the community to keep us connected and informed and together and up to date on the issues we care most about as Black women. There are many, many issues. It's our spot for mind, body, spirit, and financial wellness, and to talk about those topics that really impact our lives deeply. And this morning, our topic is one that we want every Black woman in Wisconsin and beyond to join us for. So if you missed today's broadcast, if you'll be watching this on playback, we want you to share this video from our Facebook page with every Black woman that you know as we talk about the health of Black women across our state, and specifically a state of emergency fighting for Black mothers, babies, and families in Wisconsin. We are joined by a very wonderful team today, the Lifecourse Initiative for Healthy Families, which is a project of the University of Wisconsin, and their illustrious director, Gina Green-Harris, and members of her team. I think we have about 5 or 6 members of your team with us today, Gina, and we will introduce every single one of them in just a moment. But first, as always, we'd like to give you a few announcements and to tell you a little bit about some things we want you to look into, to follow up with, and to support. So Aaliyah, turning it over to you.
Thanks so much. Yes, we're going to learn a lot about our illustrious guests from the Lifecourse Initiative. I will be popping their website address in the chat as well, so you can research them, look them up, ask them questions as well. And as Lisa started this conversation, it is the season of giving. And why not give a gift that empowers? And so I will be putting in the chat the foundation's shop for you to pick up your Well Black Woman shirts and your Well Black Woman mask, because we are still within a global pandemic. We must continue to safeguard our health, and our mask is our last and best defense for this. So please pick one up. And just yesterday we had Giving Tuesday, but we know that the giving continues on through the end of the year. And we would ask, as you think about the organizations and individuals that you want to support, we would ask that you think about individuals within our community. We would ask you to think about Black women and families, and please consider donating to the foundation. I will put all that information in the chat. Thank you.
Awesome. And as you're considering donations to the foundation, we also ask that you consider donations to the Lifecourse Initiative for Healthy Families. I think we've put their link in the chat. All of our organizations are working in the same direction for the same cause, to support Black women and families throughout our state. And your support is needed, as always, to support our efforts. So on that note, Lifecourse Initiative for Healthy Families. Gina, we've been doing some work together for quite some time on the fringes of this very important issue. You've been deeply engaged in leadership around health equity and families for a very long time. And I know the Lifecourse Initiative is one of many things that you do, one of many efforts that you lead, but we're zeroing in this morning on the issue of Black maternal and child health in our state, which is truly in a state of emergency, and it has been the case for quite some time. Lifecourse has been around for over a decade, working in the areas of Milwaukee, Kenosha, and Racine, correct? Milwaukee, Kenosha, and Racine, and has made quite a few inroads into developing strategies, but we want to hear from you what the Lifecourse Initiative is, and we'd love for you to introduce your team members as we jump into questions. And of course, to remind our guests to please place your questions in the chat as we go along. And as we go along to ask questions and to introduce Gina, we'd love for you to also tell us in customary morning coffee fashion how you're doing this morning on a scale of 1 to 10, because of course we care about how you're faring in this very interesting time. So let us know how you're doing as the wonderful Gina Green-Harris, Director of Lifecourse Initiative for Healthy Families, introduces herself and her team.
Well, thank you so much. And good morning, Lisa. Good morning, team. Good morning to community. All of this is fantastic. I want to thank you guys for having us on the coffee show. It's an awesome space. We are all incredibly excited to be here and to join you. And as you said, Lisa, we've been on the fringes of working and doing things collectively for several years. And so this is just awesome to be in this space together and knowing that, again, this is not the end, but maybe just the beginning of greater works as we continue to move forward. Giving a shout out to your background team, to everyone who got us ready this morning and making sure we were on point. I want to thank you guys for that. And then I'm excited that, yes, as Lisa mentioned, our entire, or not our entire team, but a lot of our team members are here today. And I'll certainly introduce those folks before I get into talking a little bit about Life program. And you will actually hear from them today, which I think is going to be incredible, because you often, you guys hear from the director, the leader, but these are the people who are in the trenches doing the excellent work that we're going to talk about today. So as Lisa said, I am the director of the Lifecourse Initiative. I have been in my space I think a little over 3.5 years now. And though life has had this trajectory, or this life of LIFE of over 10 years, I will just say that as a director the last 3 years, we have significantly focused and refocused and repurposed the life direction to be more inclusive and intentional around dealing with issues that are, we know, plaguing Black women in a unique way, where we are really articulating the need to have Black women's voices in this work in a meaningful way and through the lens of that perspective. And so having done that, we have, which is why you see more folks on this screen, we had to repurpose our own office and restructure our office to be more inclusive. And I'll talk a little bit more about that. But first, I do want to introduce our team to you. And then you guys can have your own say, your own way. But I want to recognize Pernice Love, who's our Racine strategist, who's on the phone. Pernice, you want to throw a wave up? Atifa Robinson, who's in Kenosha. She's our Kenosha strategist. And Patricia Bateman, or Pat Bateman, which many of you have probably seen Pat for years, because she's been with the Lifecourse about 4 years now, Pat, right? So you've been around the block a while with me. And Pat is our strategist in Milwaukee, but has been the strategist in our last iteration of Life. So she focused on Milwaukee, Racine, Kenosha areas as well. So you may know her from around the state. And then finally on the call, but not last to our team, is Vivian King. And Vivian King is our communications consultant and advisor. And Vivian has been with our team for the last year and has really helped us to create a new and better image of Lifecourse Initiative through media. And so as you guys probably can imagine, with what is happening with COVID, that was a critical role for her to play with us and still be, relative to the work that had to happen. So I'm incredibly excited about the team that's here today. And so I will do a kickstart to just say, for the last 18 months, 24 months, we have, again, really went back to reassess what is Lifecourse Initiative work really all about. When we first started, we used a really big model, Michael Liu's 12 points of Lifecourse. We tried to do the whole kit and caboodle. And we knew that that was important and that was critical to the work to address infant mortality, to address Black women's health. But that was just absolutely unattainable kinds of goal setting. And it didn't make sense to even talk about SMART goals, because we were not able, quite frankly, to do what we knew we wanted to do in terms of changing the pendulum and having better outcomes for Black women's health. And so, you know, we reassessed ourselves. We spent tons of time in the community, and Pat Bateman can talk about this work, where we went into the community and did tons of listening sessions around what is it that was missing from the life course work that was really relative to Black women's health, and changing this trajectory of outcome around poor birth outcomes. And so we wanted to really articulate that and understand from the community perspective how we needed to make that difference. So we spent the last several years doing that. And as a result of that, we, again, as I said, have morphed into a completely new program that is inclusive of Black women's voices, that is inclusive of community voices, and structures that are going to change not only policy, systems, and environmental change using all caps, but in the interim of everyday living for Black families, Black women. So I will actually ask the team, Pat, do you want to share our background about what we did and how we got to where we are in terms of starting with our community conversations, and then how that has bridged us to the work that we're doing today?
And really quick, Gina, before you do that, let me level set, because we had quite a few folks to join us since we first opened the call. So again, today, you all, we are talking about the state of Black women's health, Black maternal and child health in Wisconsin. And so for those who may not know why this topic is so urgent to talk about right now, we know presently Wisconsin leads the nation in Black infant mortality. A baby born to a Black mother in Wisconsin is 2 to 3 times more likely to die in the first year of their lives than white babies. And Black mothers in Wisconsin are 5 times more likely than our white peers to die in childbirth or as a result of childbirth here in the state of Wisconsin. And these are alarming statistics that we learn, as Gina learns, as her team learns, as we learn here at the Foundation for Black Women's Wellness, that our broader public is not always fully aware of these really egregious disparities in health and birth outcomes that are happening in our state. There are many, many organizations that have been working on this issue for many years. Lifecourse Initiative is one of them, and their position is so significant in this, and that they are working in 3 cities across our state where we see these numbers most alarming. Milwaukee County being the primary content of many, many articles over many, many years about the alarming birth disparities in Milwaukee, Kenosha, and Racine as well. And we know, ironically, here in Dane County, our rates are actually higher than Milwaukee. And this is something that folks don't really know. So whether we're looking at Milwaukee, Dane, Racine, Kenosha, where you find Black women and families in Wisconsin, you find unacceptable disparities in health and in birth outcomes. And it really is an urgent conversation, and one that we will be elevating collectively in 2021, because our full state needs to understand the gravity of this issue. So in having Lifecourse here today, as an organization, as a part of our university system that has been working on this issue for nearly 15 years. And as Gina said, resetting their course to ensure that their strategies and their efforts are being informed by Black women and families on the ground. We are doing our due diligence today to inform you in the hopes that you will inform others, and to hear from Vivian now about what exactly is happening on the ground from your vantage point, and from the other city representatives that you have, Gina. What are we seeing in Racine, Kenosha, and Milwaukee with Black maternal and child health? Vivian.
Well, I think that, you know, one thing that we are seeing is that women that we have talked to are starting to tell us what they need, tell us what they're wanting. They're being empowered by our messages, that they know their story, that they know their bodies, that they know their families. And we try to connect them with the organizations within our target areas, Milwaukee, Racine, and Kenosha, so that they can get that help. And I think one of the things that our strategists are doing is really working within each of their communities and finding those organizations that are helping, that are wanting to do the work, and to the extent that they need capacity building, they are working to do that. And we have just started a campaign that really was born from the many community conversations that Life was doing starting 18 months ago. And, you know, I think I want to hand it off to Pat to kind of start that process so then we can get back to what we're doing today, because that groundwork was really the reason that is really the reason that we're in the position that we are today, able to help so many women, and so many women coming to us and looking to Life to let us know what their needs are.
Absolutely.
So thanks, Vivian. So trying to get back to what Gina was talking about, you know, when she came on as the director of Life, and we were using a collaborative model. And what we found with that collaborative model is that we were not reaching folks from the communities that were directly impacted by infant mortality, and that had those lived experiences. And so from that point, we started to have conversations, intentional conversations with community folks about the issue and what is it exactly that Life could do and what exactly it is that they needed from Life. And so we started with these conversations and we heard loud and clear from our community that nothing about us without us. And so we knew from that point on that everything that we did from Life, and with under Gina's direction, made an intentional effort to make sure that community voice was included in that. And so we started out with community conversations. And what we heard from members of the community is that, look, we want a place where we can come together. We want a place to commune. We want a place to talk to one another. We want to learn and hear from one another. And so hence starting our community conversations. And so we did those, as Vivian mentioned, with our campaign. So even before, with the thought and idea of our campaign, we went directly to our community and said, hey, this is what we're interested in doing, to do a campaign focusing on reducing the stigma related to perinatal depression. And so our community members were awesome. And so they came together, they defined for us, what does it mean, you know, the stigma around depression? And so they gave us feedback. They told us what this means and what needs to be included in the stigma reduction campaign. And hence it was created with the voice of the community. And so we know, and as you guys know too, the power of the community, there's power in numbers. And so from that point on, we've been doing community conversations. We've had ad hoc committees that we've had come together that really provided feedback to us about what the next iteration of Life should be, and that we need to focus on one singular, social determinant, and it became chronic stress. And so we're focusing on chronic stress as our primary focus area that we are looking at, which we know is caused by systemic racism and the impact on prematurity. And so we're looking at that again from that feedback from our community. We did large community sessions, update sessions with our stakeholders, again, that provided information. And so we are using an asset-based community development model where we are using the assets of the community to direct us.
That's powerful, Pat. What's very interesting and wonderful to hear is that your process that you're leading by in Milwaukee, Kenosha, and Racine with Lifecourse is a mirror image of the work that we've done and are doing here in Dane County. And it's very important to note that the alignment that efforts are now taking and how we're approaching creating solutions and strategies to solve birth inequities by first listening to Black women. That has been the missing piece. I think often our systems, when we say systems, we're talking about health systems, public health departments, outside of our community begin to engineer solutions to solve our health crises, but they miss the important piece of asking Black women and fathers and mothers and grandmothers and community members what those solutions should look like. Over the past 3 years in working with our local health systems in Dane County, we've done the exact same process. And as you said, Pat, nothing about us without us has been our motto as well. And that has really changed the color of the solutions that we are crafting as a community, and it's really turning into investments first in Black women as leaders to drive the solutions, like our doula communities, our midwife communities, developing that community, which is really underdeveloped in terms of Black women's presence as midwives, and investing in building community capacity to create solutions within our highest need zip codes, and many, many things. So I'm just heartened to know that there's alignment in what Milwaukee, Racine, Kenosha, and Dane are doing, and thinking already ahead of how we bring those things together more powerfully as a statewide effort to really turn the tide on these very poor birth outcomes that we see. Gina.
Go ahead. Go ahead. I'll let you ask your question. I was going to share something, but go ahead.
No, share it. We're listening to you today. Share it. And I'll ask
no, because I think you're hitting the nail on the head. But I want the audience, and I want us to be clear that, what's really interesting about Lifecourse, and I think, Lisa, when we think about, for instance, your work came from the roots of the community, right? It was already there. And, unfortunately, the university was well-intended, but had a completely different ideology and concept. And it came from a top-down structure. So we're actually trying to reform, but it was all strategic. And I think what we have to remember is that, we have these strategies that we were trying to put in place about building stakeholder relationship with hospitals, with organizations, and community. And the irony is that we did the other two to a certain extent, but we missed the community totally. And so, like most other things that happen within some of the organized structures, you have to go back and fix it. And so to the people who say, well, why are you guys coming back to talk to the community? Well, that's how it should have been in the first place. That's the best strategy. And so I think while we're now using the information, and this is what I love about the work, we're utilizing the information that was established by the community to now rebuild infrastructures, like you're saying. We're talking about structural changes now. Now we can actually talk about, when we sit in front of policymakers, here's the voice of the community, and then we can articulate and translate whatever needs to happen to those policymakers so that it makes fiscal sense to them, it makes constituent sense to them, and we can actually build the framework for them to actually support the changes that need to happen that will actually come back to benefit our Black women. And we don't have to be the voice for them. We can actually bring them to the table to speak for themselves. And that's where I think the work of Life is really happening. So I will say, we spent those 18 months in the community with the community. Then we spent the last 18 months recognizing that Black women were saying, we want to be served by Black folks. We needed to build the infrastructure of the organizations to then serve the Black families, because that was the other thing. We can give grant money to organizations, but if we don't build their infrastructure to be here for the next 10 years for sustainability, that's a wash too. That's a waste. And so we really wanted to go back and say to the organizations, how can we make sure that you're going to be here for the long haul? And all the while, again, helping them to understand how to be advocates and policy changers and law with the constituents in their community so they can better serve these Black women and Black families. So I think it's all interconnected. And I do want to mention that we talk about Milwaukee, Racine, and Kenosha, but Life actually was in Beloit. And we know Beloit is a whole nother conversation. We won't have that today, but we know we need to your point, Lisa, Dane County, we need to continue to look and say, how do we make sure we're more inclusive collectively so that we can serve even more folks? Because we recognize that this issue is not as isolated as what has been perceived before or even taught to us in error before. And so we're trying to go back and correct a lot of those things. So I just wanted to kind of bring that out and share with the folks today.
Yes, and so those who are hearing all the many layers to this conversation, we're talking about Black maternal and child health, state of emergency in Wisconsin, where we lead the nation in Black infant mortality and with unacceptable maternal mortality rates, deaths of Black mothers related to childbirth, which are overwhelmingly high in the state of Wisconsin, an unacceptable reality that we are all working to change. There's a personal element to this conversation, Gina, because as we've all alluded to, it starts with Black mothers. Black fathers, Black families. And when we talk about Black infant mortality and we talk about maternal mortality, those are our formal terms. But what it comes down to is Black women are giving birth to babies or carrying babies who are not living to see their first birthday. On a personal level, for any woman who has carried a child and lost that baby, particularly after bringing it to term or almost to term, because premature birth is a big part of the low birth weight crisis that we see, babies being born too soon. It's a devastating experience. I mean, these aren't even the right words. It's beyond devastating. It's unspeakable to think about losing a child, early term, midterm, full term, but to hold a baby in your arms that has been birthed and to see the life leave that baby's body. That's what we're talking about right here today. And the alarming number, the 2 to 3 times greater rate at which this is happening to Black babies and mothers and families in Wisconsin. Nationally, it's happening, but it is happening here at alarming rates. And the questions that we have to ask about what we do to stop it. It has been Black women really on a national stage who have pushed this issue to the forefront. Organizations like the Black Mamas Matters Alliance, the National Birth Equity Collaborative, and others, many, many others. We're happy to see congressional action being taken about this issue, but that's not necessarily changing immediately what we're seeing happening here in Wisconsin. So that's the context of what we're talking about today and what we need to do systemically. We're talking about systemic efforts today, like the Lifecourse Initiative, like the work of the Foundation for Black Women's Wellness, to change the systems and the structures that are pressuring and creating barriers to Black women and families, that are driving the inequalities that we experience around economics, education, opportunity, healthcare, that drive the stress, that impact the health of mothers, that are resulting in these birth outcomes. So there are systemic pieces, and therefore we have to talk about how we change systems and structures to change this dynamic. On that note, Gina, we know that Wisconsin, receives very high rankings for healthcare quality, on national and international rankings, but we have this strange dichotomy of being the best in many ways, but the worst for Black health, period, Black maternal and child health. What do you think is driving? We talked about root causes and how you all have concluded that one of those root causes that you're going to address is stress to Black mothers, but paint the picture on what we know structurally is driving these poor birth outcomes.
Sure, and I certainly welcome the team members to join in with me on this question. But I'll start by saying, when you think about the demographics of the state of Wisconsin, you just have to be honest about it. And Wisconsin is not the most heterogeneous state in the nation, right? It's very homogeneous when you think about it. And what I mean by that is that, you've got Dane County, and it's my understanding, I'm not from Dane, but when people always remind me that when you look outside of, the small portion where, Madison is and where Dane sits, outside of that is very rural. It's very kind of, the intersection is, dense, and that's where you find your population of particularly colored folk, right? That's your urban setting. And Milwaukee, Wisconsin, the Milwaukee area is the same way. So when we talk about, and as you mentioned, Lisa, the Southeast Corridor, right? So that is where you find your largest populations, along with, we'll say Beloit as well, that area, right? That Rock County area. But that's where you find your greatest number of minority populations, and particularly Black folks, right? So when you have a state that is so segregated, right? And then inside of that segregation is hyper segregation. And that is where I would, if you were to look at Milwaukee in particular, Milwaukee proper city is where Black folks really reside, right? And but if you were to look at Waukesha, if you were to look at Brookfield, all those Oconomowoc, all of that, go closer to Jameswood, you're not going to find that there's going to be a lot of people of color in those sections. and in those sectors. And why is that critical? Because when you look at what's happening in Milwaukee, that's where a heavy layer, when you're talking about social and systemic racism, that's where it's happening, right? So that actually, it impacts a lot of our health outcomes, right? We don't have access to certain hospitals. So let's say we have federally qualified health centers, which we do. But are there the same level of providers in terms of specialties in those clinics and in those areas? The answer is absolutely not. Not because they're bad spaces, but that's not what they do. So what happens is that our health disparities are, quite frankly, increased in our communal settings. And so as a result, we have poor health outcomes. We don't have as much access. And even when we do have access, it is not to the same quality as some of our neighboring partners, right? So if you go, and this is just Milwaukee living, quite frankly, we can just go right down the street to from Milwaukee to Menominee Falls and experience a different level of care. So that's one setting. That's one reason. So we're talking about healthcare access, but then we're talking about quality of healthcare, right? So we walk into a hospital setting or a doctor room setting or our healthcare environment, and we're looking for the same quality of care that a woman who's in Waukesha would receive, and we don't necessarily get those same benefits. We don't necessarily get the same quality of care. So I walk in, I'm pregnant, and I'm having challenges or concerns with some of my pregnancy. I'm going to be looked at differently by a provider than a person in Waukesha will be looked at. That contributes, right, to one, increasing my stress of how you talk to me, two, how you serviced me, three, how did my delivery come out? You won't allow me to have a doula in that conversation, right? Does that impact me? Does that impact my stress? So I'm talking very practical kinds of things that we know are happening. So when you look at those exponentially to look at the larger picture of the birth outcome numbers, all of that comes into play. And I think what happens, quite frankly, is that we get so lost in saying we're 3 times more likely to have a poor birth outcome that we don't drill down enough to say, but what are the practical implications of why that's happening? And so that's where, we lose some of the traction, because doctors can get off by saying, I did everything I would do for you that I would have done for the woman in Waukesha. But when we check the records, when we check those medical records, we know that's not the case. But because we're so busy looking at the global pieces or just the data sets, that we lose sight of the real people. I think those are issues that we're facing as well. And so one of the things that we're doing through Lifecourse, again, is as we're changing, Dr. Zapata, I don't know if she's still on the phone, but Dr. Jasmine Zapata is going to be our new co-I and associate director, and working with us to actually bring all of what you're talking about, Lisa. Bring the doctors to the table, bring the clinicians to the table. But it goes beyond just providers in form of doctors. I'm talking about when you walk in the front door, quite frankly. I'm talking about the infrastructure itself of recognizing that Black women are treated unfairly and inappropriately in these settings. And so we really want to talk about that. And that's a Wisconsin thing, that's a Midwest thing, but that certainly is something that is contributing to our poor birth outcomes. How we treat Black women prior to pregnancy, I could go on about that, is also an issue when we don't even address Black women's health in general. And understanding that, we see things through a different lens. Our care models are different from what is traditional around white women's care models. We need different things. And so we're not addressing some of those through care systems. So, but I think those are definitely ways in which we are different and are continuing to experience birth outcome challenges. So I will stop there, and I don't want to answer the question for everyone. I know everyone's doing stuff. The team is working with the doulas. We're working with our midwives. We're working with our therapists, because that's the other piece about this. Mental health is critical to Black women's health overall, and we're missing that link as well. And so when you talk about birth outcomes, that is something else that's critical to our work as well. So I'll stop there and ask the team members if they want to join, or Lisa, if you had another question. I think Dr. Zapata may want to say something. I know she said she may not be able to, but I do want to acknowledge that Dr. Zapata, Jasmine Zapata, and most of us know her, Dr. Jazz, is also on the line today.
Yes, and we will defer back to Dr. Zapata in a moment. I do want to give a nod to mothers on this call, to the sensitivity of this topic. It's a very difficult conversation to have, particularly from mothers who have survived, mothers and families. You know, we always also acknowledge fathers, mothers, fathers, families, because when we lose children, the whole family loses that child. But for the mothers, particularly many on this call who we know have lived and survived this experience, whose work, who have now created work and have become powerful advocates. We know for a fact that Dr. Jasmine also experienced a troubled pregnancy, an incident of premature birth that really informs her work as a physician, as a pediatrician. I want to nod Felicia Turner Walton, who is on the call today, who is a powerful mother, who has lived this experience, who is a leader in our local community here in driving change in this area, has created her own organization and is also a member of our newly launched Black Maternal Child Health Alliance of Dane County, which is a 21-member body of Black women who will be helping to really craft solutions in a new way, in a different way, from a powerful personal lens and professional lens, as their work is also engulfed in Black women's health. So I just wanted to nod the mothers and to nod you, Felicia, in the Healing Our Hearts organization and Dr. Zapata. What you said, Gina, is so very important. When you said beyond the data, we talk data all day long. We have to talk data. We have to talk data to speak the language of systems as we're trying to press them, partner with them to do the structural changes that we need, as we talk to funders, to ask them to support initiatives in our community that drive the solutions that we know we need. We have to talk data. But we also have to talk about what is happening, as you said, beyond the data, the experiences that Black women are having when we interface with the healthcare system, when we interface with our community to get to those root causes. And what we know we hear consistently from Black women is the stress of living while Black, which means the stress of racism that is imposed on our lives in every facet of activity, from how we secure housing, the affordability of that housing, the quality of our food, the quality of our healthcare, the educational opportunities we have access to or don't have access to, our children's experiences, what our partners face in trying to seek employment, unemployment, underemployment, housing insecurity, economic disparities, and what that looks like on a personal day-to-day basis as we're trying to make a living and navigate life. Is those daily stressors shaped by racism, exacerbated by the doctor's appointment experience. You know, I read a tragic story last year. I think you all are keenly aware, as you said, Gina, just the poor quality of Black women's health, how unserious we're taken as patients. The story of the woman who went to Frederick Hospital in Milwaukee to seek care for chest pains. And she was a relatively young woman in her 40s, like myself. And she was ignored and told to wait so long that she left to go to a different hospital. And she died on the way to the other hospital. These are the stories that we hear from women who call us from across Dane County, from across the state, asking us to intervene. I won't name the hospitals, you know, don't want to name call right now, but complaining legitimately about the doctor didn't hear me. They didn't believe my symptoms. They did not accept my pain threshold. They didn't medicate me. I told them something was wrong. I was feeling something strange. They didn't listen. This thing happened to me as a result. And we see now studies documenting. We were on a call together, Gina and Dr. Zapata recently, where we shared the statistic now on a national study that Black babies cared for by Black physicians have a far greater chance of surviving than Black babies cared for by white physicians. As to say, a national study that's a credible study that is telling us what Black women have been saying all along, who weren't believed, and now the data is legitimizing what Black women have been saying, that our quality of care is different and it becomes a life and death matter, which is also, No, go
Lisa,
ahead.
let me not interrupt you, but the interesting thing about that report, which is so critical, is that it's telling us that we know we thrive better with Black provider care, but the reality is that only, what is it, less than 4% of all Black providers, we only have 4% of providers that are Black, or, you know, that speaks volumes. So while we know this is essential, we don't even have the capacity. Think about that. Less than 4% of all providers are Black in 2020. That number was the same. And Vivian, you can correct me if I'm misspeaking, but that number hasn't changed over 20 years. Because, and that speaks volumes to say, how has the level of care for Black people changed? And you know, when you think about the Institute on Medicine's first report about this, remember the report that came out that invoked all of this came out in 2000 about the health disparities that actually was unequal treatment that the Institute of Medicine actually did to unleash all of this data that demonstrated that providers were not caring for Black folks the way that they needed to be cared for. And that really launch padded all this other work that's also being done. And so I think, to your point, we know what needs to be done, and as a collective effort, we need to come together and continue to forge ourselves together to do this. Because if we continue to just kind of talk about it, and I think the work that you guys are doing is phenomenal, right? You're in the trenches, you're making the difference, you're building the relationships, you're making the formidable changes that need to be made, or forging. I won't say making, you're making people make the changes, right? Because no one's coming to this saying, hey, we've been waiting on you, girl. Unfortunately, that's not what's happening. We are, but I will say this. What we do know, and this is why it's critical, and let me be clear, when I say the numbers don't get lost in the numbers do matter, because there are certain sectors that only look at the numbers. So they really do matter. And we have to take that and forge and bust through some ceilings that we otherwise wouldn't be able to bust through. And I'm excited that we're doing this together, because the reality is that as long as we allow for the segregation of us, right, to do them only in Milwaukee, only in Racine, only in Dane, we will never be able to bust the glass ceiling. So I didn't mean to interrupt you, but I just I think about how we know what needs to happen, but the question is, how do we make it happen? You know, we talk about pathways for new providers, new physicians. We talk about all these programs that need to happen, but we have to force them to happen, because people have been talking about this forever. We are at the point of from promises to action. It is time that we actually do the work. And that's where life is coming in. We're talking about, I don't want to talk about it anymore. We just want to do it. And so, you know, we're building the mental health wellness groups. We're building the think tanks with families and providers. We're building all of that now, because it's time to say, like you're saying, we've got to see changes. And with the work that you guys have done, the support and the guidance is essential, but we know we all have the tools to make this work. So, and I do want to acknowledge, Lisa, you acknowledged loss. Pernice Love, who's on our team, also is a mom who has experienced challenges with her childbirth experience. Her daughter is alive as well, but you know, she talked about that on our webinar, about the experiences that she had that denied her care as a Black woman. Now, she's a Black professional woman, and we all know that's that, but I do want to acknowledge her too. And I didn't mean to interrupt you, but I'm gonna stop there. So
No, this is good. This is good. And I know that our audience is relating to this from many, many angles. We have Black women on this call who are working in systems, in public health, in healthcare, and community-based health, who are driving this and understand systemically. We have women on this call who have birthing experiences that we are reflecting in this conversation. We have women who are community-based neighborhood grassroots advocates who are trying to inform communities. So all of this is relevant. I do want to switch gears a little bit to talk about experiences of Black women. So Pernice, you know, just to give voice to that on this call, I think it's very, very important that we hear perspective from a mother's perspective who's lived this, to color it. What can you say as a survivor, and I'm so happy to hear that your baby is here. Your little one is here with us, and it's tied to our determination that Black women have to lead this work. You know, Black women have to lead this work. Black women who have first world experience have to lead this work as we look at the women who make up the ranks of our doula communities, of our birth worker communities, as our advocates around this issue. Many of them have survived and lived these issues or know someone who has, and we're so very interested in driving that type of leadership by Black women, for Black women, with the support of systems, but us at the helm. How has that shaped what you do from that personal experience as a mother?
Good morning. I first want to acknowledge and say thank you for acknowledging my trials and tribulations. I've actually had 2 preterm births. And I actually have one of my babies are actually on this call. So it's nice to even see that she's even live and here and actually in this, listening to this discussion. So I would say that overall, so I'm going to say 2 things. When I first had my second baby, I was crying and boo-hooing and, you know, going through the whole ordeal because last time I see my baby, he had stopped breathing and they were taking him up to the NICU lab. And when I got there, I was told by the doctors and the nurses, like, you need to breastfeed that baby. You need to breastfeed that baby. That's the best thing you can do for that baby. And those were all by Caucasian individuals. However, when I made it to the NICU lab, it was a lady who was African-American, a mother who was like, baby, what you crying for? And that's exactly what she said to me. What are you crying for? You can breastfeed that baby and that baby will be fine. And she told me, she told me, and I'm up there like, okay, you know, and trying to get myself together. But in reality, I took heed to what she was saying, because here she is, an African-American mother, like I, and she was going through a very similar situation, like I. So I breastfed that baby. My other thing is that I wanted to give back to the community what I experienced. I don't want anybody else to go through. So knowing that I almost lost not 1, but 2 babies, that right there was enough for me to say, I don't want anybody else to have to go through the same tears, pain, fear, isolation that I went through. So that right there, it was more or less of me finding where I fit in, as far as I don't want to be, I'm a person who, I don't want to be at the top of the chart running things down. You know, like I don't want to be at the top. I want to be the boots on the ground, because to me, that's where that impact was. Mm-hmm. Also, another reason that I'm here with Life is because Life is based on African-American birth outcomes. So not saying that nobody else's outcomes don't matter. I'm not saying that by far, but I am worried about my people. And to have a team of African-American people. So when I go to my boss and I talk about a situation that I may be facing or have faced, I know she gets it, because she has either experienced it or someone else around her has experienced this. So that, Miss Lisa, is the reason why, that's what drives me to do this work. Me and Gina laugh, and Pat as well, and Tifa and Vivian, because I have some big dreams. Yeah. And so this is only, to me, like, I know where we're at, and I know we had to go through a transitional shift, but that transitional shift was not just based off of like Gina said, it was some things that also occurred in between, you know. But listening to the people talk and tell us what they want. So it's no longer just like, it's not my dreams or Gina's dreams or Life's dreams. This is what the community is telling us. I do want to piggyback to Gina. I've been very quiet, you guys, and I'm gonna be quiet in a second, I promise. But Gina made the comment talking about the healthcare systems, you know, and I want to go back and acknowledge that it's not just Gina saying this, and this is not just data saying this. Like, this information also came out in our community conversations, not only in Racine, not only in Kenosha, but also in Milwaukee. So it's not just like we pulling data and information out of the sky. It's like, this information is actually real life, what our community members are actually saying. Mm-hmm.
Atifa, thank you, you are so welcome. Thank you for that, Pernice. And I must say, I love your name, Pernice Love. That's just, It sounds like a celebrity name. You need to write some books with a name like that. I want to give other members of your team, Gina, an opportunity to talk. Atifa, I want to hear from you. And then I want to hear from Aaliyah. I want to give Aaliyah the stage this morning. We're not really following our script. We're letting this conversation flow. But as the co-chair of the Black Maternal Child Health Alliance that we recently worked to co-establish together, I'd love her to just mention that and give some background on that work. But Atifa and Vivian, I know that you work boots on the ground and with communication on the Lifecourse team. What are you hearing, specifically from Black women in Racine, Kenosha, Milwaukee, when they say what they need, what they want to have better birth outcomes? What are their experiences, their aspirations, their vision for how we improve these things where they are? What are you hearing from them?
Well, Lisa, again, thank you for having us in the Kenosha area. What we are hearing is more of racial equity and health equity, food insecurities. Mostly they hit on all the social determinants of health, and that our African-American women, one of the last situations where doctors were refusing to see them if they weren't able to pay the co-pays. And so it's more of those financial outcomes. It's more of the doctors not being culturally appropriate, implicit bias, unconscious bias, assuming that Black women are strong and that we can just weather through anything, and that we don't want to raise our children appropriately. And so they give us care that's not appropriate. And so just with me and my experience, just working, I too experienced having 2 premature births, but mine was different. I had an African-American doctor who walked me through and helped me to advocate for my health and for my children's health. So my steps were easy. I was able to talk to my insurance company. My kids had everything they needed. And so when I tell people that story, that mine was more like a dream. Some of the African Americans in Kenosha would like policy change on maternal child health to make sure that it's mentally appropriate. There's not a lot of African American providers here. We have about 5 here that are African American. 1 is men, 1 male we have, and then we have 3 African American women. The other thing is African American OBGYNs. We have probably about 2. And so what they're asking for with the mayor and some of the community leaders right now is policy change around maternal child health, policy change around infant mortality, policy change around chronic stress. And they're working with the hospital systems, all 3 of our hospital systems, even our community hospital system, to navigate and create a plan. They're looking at least a 5-year plan. They're bringing all different leaders to the table right now, just to adjust, to make sure that the plan looks equitable. Also, we're working with the Kenosha County Division of Health, because they do have the maternal child health, to look at Black health, because right now they're only focused on Caucasians. And so they're looking at Black health to come up with some strategies that could be statewide. And so they're looking for who can they partner with in different counties across the state to move those needles. So for me, just the experience and just sitting into the other spaces, they are looking for changes to improve mental health, physician outcomes, and just making sure that they're listening. Through those community conversations, what we found out is that a lot of people are not listening to the patients at all. They're very dismissive.
Mm-hmm. And I think the thing, like what Atifa's saying, Lisa, that what's important from our perspective is that I can tell you that probably about 4 years ago, Life would not have been asked to be at that table or to lead those initiatives. But that has transitioned, and the work, because of the work and how we're doing the work, we are now being asked to not only sit at those tables, but to help facilitate and guide those conversations. And I think, again, that's where the work shift building the relationship with the community was so critical, because now we have that trust, we have the respect, we have the credibility, and we are seen, and again, the team can say this better than I can, but we're certainly seen as the leaders in the community settings around these initiatives and around these what we know are needed, what I'm calling paradigm shifts. And so, you know, in each community, we're all sitting on different levels. You know, Pernice is at the city government now with Racine. You know, Pat's doing the work in Milwaukee. And so, and like Atifa saying, so as at those tables, it's then the potential opportunity to say, hey, we need to bring in this organization. We need to bring in that organization. And we need, this is how we're going to get this paradigm shift, not just for Kenosha County, but for the state of Wisconsin, if that makes sense, right? And for all these other counties that have to be included.
Yeah, what's coming to mind for me right now is something that I want you all to take away from this call when it ends in a few minutes, is the personal is political. I was a sociology major in undergrad, and Bell Hooks is one of my mentors and one of the most powerful women whose writing and works has inspired my life and my work. And that lesson that the personal is political is so true for Black women. These personal experiences that we are walking through in this American journey, right? As we confront disparities in our health and our birth outcomes and in all other levels of our lives, we have to drive the change, and we have to get involved in the public domain about how we change these things, because no matter where we position, this is affecting us. No matter the state, the city, the county, you're hearing that the messages and the experiences are the same. So I just want to plant that seed to say, as we're learning and as we're organizing, as we're going through personal experiences, to know the power that we have, as we heard Atifa speaking about community wanting to impact policy change. That's a huge part of the trajectory of this work that the foundation is on, that Lifecourse is on, that the Black women on the community level. We have to move from the personal into the political to change these systems and dynamics that are impacting our health on a personal level. And it's very possible. And we look very forward and are very excited to join our heads together with Black women through life and across the state to drive policy change together. You know, that's a scary word for us in many ways, but a necessary step that we have to take. And it's everyday women like us on this call who have the power to drive that change. Vivian, do you have a few comments to add? And I think, Pat, you were saying something as well to help us kind of close out this sense of how Black women can drive change. And then we'll hear from Aaliyah, and we'll ask one last question on where do we go from here? So Vivian, Pat, Aaliyah, and then Gina.
So I did just want to recognize that November, of course, was Prematurity Awareness Month. And we had a powerful webinar that featured Dr. Jasmine Zapata and Atifa and Pernice and some of our mental health providers. And so we really talked about everything that we've been sharing today. And it opened it up to a broader audience so that they could really hear, you know, that this thing is all over the spectrum for Black women and Black families. And we talked about fathers and how they deal with it as well. And so that's one thing. And we're going to be doing more of that. And the other thing is our campaign that was born from those community conversations that Pat talked about is called Strong Moms Are Covered by Strong Villages. And it uses quilting because quilting is so tied to the African American community, and it symbolizes covering the mother just like a village needs to cover the mother as well. And so I put in the chat our Facebook page, so you can, I would have shown a testimonial, but you can see all the testimonials as they are laid out on our Facebook page, and then on our Strong Moms, Strong Villages website, and then on our Life website, which I will also put in the chat as well. And we just want people to like that page and become a part of the community so that then we can know what we have a continuous feedback loop so that we can see what the community is needing and the community can see, you know, what we're doing to try to help them.
Wonderful, wonderful. Pat, what can you add to that?
Well, I just want to add one of the things, because you've been talking about, what women, Black women need and what they want. And so what we've been doing and working with, we know during COVID, and we've heard many multitude of stories of Black women that have gone in to deliver babies during this time of COVID and have felt the impact and the infringement upon their rights as Black women and as patients. And so in our work with doulas, and the doulas that are specifically working with these moms in hospitals, and really working with them to help them understand and embrace the power that they have as doulas. We've moved from doulas across Milwaukee to expanding that into Racine and Kenosha, and increasing the number of doulas across the state, but then also providing and making sure that these moms have accessibility to doulas. And so what doulas are doing, what Life is doing, is working with them really to help build that power and really help change systems in the healthcare, because what they're finding is that, healthcare systems are challenged by, they need doulas. And as we say to them, they need you more than you need them. And this is not about asking the healthcare system, invite us to work with you. No, you demand, because this is, critical time, and it's so important. And so what we're working with these doulas now for the healthcare systems across, our 3 life communities, is that we're helping them work on, a declaration as a resolution to our hospitals and our healthcare systems about the importance and what it is and how they need to work with doulas, and develop policy with doulas and coming into those healthcare systems. Because what we're finding is that they, again, want to dictate, what those doula services. No, you don't do that. You don't infringe upon a woman's right to choose. And so what they're seeing is that these healthcare systems are saying, no, you can work with a doula is welcome in, but she has to be certified by a certain, and so we're working with doulas to really get out there and really use their power to really help healthcare systems get on board.
That's absolutely wonderful to hear that the same strategy is, we're hearing that we have some aligned strategies that we need to capitalize on. The expansion of doulas is one of the biggest focuses of the Saving Our Babies work that we're doing here. We're happy that our health systems have begun to invest deeply in doulas. In the doula community here, the Harambe Village doulas are advocating hard on multiple fronts, and they are training doulas each year. We nod them, as well as Maroon Calabash doulas in Milwaukee. And I hate to name names because there are many, many groups of Black women who are doula organizations, many, as well as the African American Breastfeeding Alliance of Dane County and the Alliance of Milwaukee. Black women are on the ground, pushing, doing, creating solutions. And now our step is to attach policy and practice and dollars to expand these initiatives across our state, because much of this change, as we've said, is going to happen outside and beyond the system with community. On that note, Aaliyah, I'd love for you to share briefly the Black Maternal Child Health Alliance that was recently launched, as well as the work that we'll be developing with the Well Black Woman Institute, how that will shape the power of Black women to drive change. And then to hear from Gina, where do we go from here? So Aaliyah.
Thank you, Lisa. It's impossible to capture all that work in this short of a time. We must have a part 2 to really truly discuss the level of work and the individuals that take part. As we've been talking in the chat over here, which has been another complete conversation simultaneously, is we are the women that we are fighting for. We think about the health outcomes of our grandparents. We think about the health outcomes of our parents. Shout out to my mom, Miss Carla Stevenson, on the call. And then we think about our health and what's happened to us. Now we think about our grandchildren. So the story hasn't changed. So I'm really excited to know that we're capturing the stories similar to the work that the foundation has been doing with the Local Voices Network in capturing these stories, and similar to the work that Life is doing with the Facebook testimonials. We must have some accountability and transparency, and we must have women be able to feel comfortable, like Felicia and Pernice and myself and others, coming forward with their stories and holding people accountable. And that's what I'm really excited about the Black Maternal Child Health Alliance. It's an alliance that came out of the recommendations from the Saving Our Babies report, the collaboration between the Dane County Health Council here and the Foundation for Black Women's Wellness, that created an independent freestanding body of 21 incredibly talented, amazing, shout out to the ones that are on the call today. There's many others, but Dr. Jazz, Corinda, myself, Felicia, Lisa, others that are together. And again, they have the personal and the professional. What we're talking about here is an entire approach that needs to be on the policy side, on the birth worker and representations and changes. And the wonderful thing about the Black Maternal Child Health Alliance is that individuals in that room represent all of those sectors and are approaching it and bringing expertise from all those places and from the place of being a Black woman and mother. And then we sit at the table with the Dane County Health Council and are co-informing strategies. And again, providing that transparent accountability and that voice that they don't have access to that we do as, again, people who sit in community, those first line on the ground folks, and folks again with those personal stories. And so when we think about that, and as we bring in more sectors into the conversation, the business sector and others, that's where we're really going to see change. And that's why we're excited about the Well Black Women Institute, because that institute will be a Wisconsin-wide training ground for health equity leaders. So to train up Black women and put them around the table where these decisions are being made in the health systems, but also in other systems that impact our outcomes. And that includes, again, the business community, because we know from the social determinants of health, it's not just what's happening at our doctor's office, it's what's happening and where we're getting hired, it's the type of education, it's where we're living, et cetera. So we need to be around all those tables. And we know that women are in community right now doing incredible work and just need the tools to be able to expand their reach and their influence. And that's what we're looking forward to doing through the Well Black Women Institute. I could talk forever, but I know that we're at the end, sorry.
Yes, and we will launch the Well Black Women Institute planning and design in 2021, launching with our cohorts in 2022. We're talking with Lifecourse Initiative already about how we bridge our efforts together to bring women in Milwaukee, Kenosha, Racine, Beloit, and Dane together in this effort as a collective strategy to drive the power of Black women forward, to make these changes in Wisconsin, to move Wisconsin from worst to best for Black women's health, because Black women need that. We need Wisconsin to be the best and not the worst for our own sake, for our own longevity. And that is what drives all of us on this call today and the work that we're doing in this community. And I think it's exciting. I'm on a panel tomorrow where the theme is around what we'll do over this next decade. You know, this next decade that we're entering is a crucial and critical one. It's a time of opportunity for us as Black women to decide what we really want, right? How we want to live on this planet, how we want to live in the state of Wisconsin, what's acceptable and unacceptable to us. And even if you're not in Wisconsin, because I think we've got some folks on the call today that are not from Wisconsin. And so we're speaking to you also, Arifa Bevan. I believe that you're out of state. I see you. I just want to nod that I see your presence on this call. It's wonderful to see you here. It's our time, you all, to determine in this 2020 and forward era, what will Black women's lives and health look like, and how will we shape it, not depending upon systems, which we've never done to drive that change, but how we will amp up our efforts, because this is a crucial time. So on that note, Gina, right now, immediately, and in this next decade, as life is transforming and we're all improving and scaling up and looking to make bigger impacts and changes, where do we go from here, and how can we support the efforts of the Lifecourse Initiative?
Sure, thank you. So yeah, I think the bottom line is, as you said, our next move is from promises to action. We really are looking, we've got the data, we've got the relationships, we've got the partnerships. It's time to do the work, and we are doing the work. It's time to, as you were saying, and as others have said on this call, and as our team has been really forging the efforts at the level of interactions and building the relationships, it is now time to just put those into practices and push like never before. I think it's time to knock on the legislator's door saying enough is enough. Let's move it forward. But I think it's going to be incredibly important, though, that we are strategic about it. and that we are doing it as a collective body, and that we recognize that at all costs, there's going to be external forces that are going to try to divide us. I just need to say that, because there's going to be so much political will against us coming together for the greater good of all Black women, that we have to be ahead of that game. And we have to have a strategic plan of saying, no, this is what we demand that we collectively do together, succinctly and synergistically as it makes sense. And so to me, that's the vision that I have. My vision is I just need to move. We need to get it done for the sake of our women now, but our generations to come. Because as Bev would tell you, if she were on the call, Bev Hutchinson would tell you, we got 3 generations to look about this. And we got to get, this is our hour. This is our time. We don't have time to argue about who's doing what, how, we know what we're all doing. As you said all along on this call, we're all headed in the same direction. We all have the same vision, but we all have different roles to play in different lanes. But we can do that. The better we recognize that and do it collectively, the better off we'll be for Black women. And the only way we won't get this done is if we allow external forces to divide and conquer us. So I'll end with that. And because I just believe that in my heart, this is about research. This is about education. This is about jobs. This is about academics. Every level you can think of, this is where we need to be moving forward with action.
Absolutely.
So thank you for having us. We are so ever grateful. Hopefully, I believe this is not one and done, but, this will be us collectively moving forward and continuing our conversations. I look forward to it. I'm thankful. Bless you guys so much. And and I'll say happy holidays, right? Because I can.
Absolutely. So you all heard a couple of things. You heard that the next decade is most crucial for us. And you heard that our collective strategic plan is Black women working together to move in the same direction, claiming our power and changing this narrative around our health. That is our strategic plan. Who commits to that strategic plan for the next decade? Absolutely. With that, I want to thank you, Gina and team. We do, as Aaliyah said, need another follow-up to this because we have so many voices. We could do this call for 3 hours, and I think most folks would stay with us because there's a lot that we need to discuss. So we're going to plan on a part 2 and a part 3. And of course, we know we'll be working behind the scenes today. We also want to thank, there were some folks from legislators' offices. Thank you to Monica Sundahl, who is from Senator Tammy Baldwin's office. I know we'll be following up with you. We are always happy when legislators are listening to community and taking that information back to inform policy. And again, we will take that personal into the political this year collectively together, you all of us, in the ways that we can to drive change for Black women. On that note, we will remind you to stay safe, to mask up. COVID is real. We are not out of the woods. Protect your lives, your families. Know thyself, love thyself, heal thyself. We are the answers we need. We have the power to transform, and we are doing it together. Thank you for being on today. Thank you, Lifecourse Initiative. Please visit their link in the chat, and we will see you back. Will we see them back here next week, Aaliyah? What's our next show?
Yes, we'll see them quite a few times this month.
We will be back next week. We have wonderful lineups through the rest of the month, and we will share more details with you. So take care, everyone. Thank you for being here with us. We love seeing you, and we will see you back here next week. Be blessed. Bye-bye.
Bye-bye, everyone.